Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching our earwax removal compilation video today. We've got two patients in this compilation video. So the first patient you can see here has come through just some quite sort of standard earwax basically. It's not too soft, it's not too dry. It's kind of the kind of, this is the normal type of consistency of wax we do. This is our day-to-day kind of removal here. So we've got the standard size on the tube on here. We're just loosening this section of wax up. There we are, we're taking that little chunk away there. You can see it's a little bit crumbly just behind, so that wax is a little bit drier, but it's coming away really nicely. And then we'll just go, there we go, in that little section there. And we'll go in just a little bit further. You can see we're just sort of working our way very slowly down the canal, just taking all these little tiny pieces away. There we go. That's come away nicely there as well. And we'll take a good look at the eardrum. So you can see the hammer bone there pointing up to the right hand side. So this is a right sided eardrum here. Looking nice and healthy though, some good sort of colour to the skin of the eardrum there. Slightly pearlescent, that's a good looking eardrum there. So this is the patient now, so obviously this is their left ear now. We're just going to start taking away, you can see a much softer type of wax here. We get a good grip, but as we pull this out, it's like this little husk that's all around the outside of the ear canal, so it's all dried into one sort of ring. There is a couple of straggly dry pieces left behind here, so we'll just hoover those up as well. There we are, you can see just taking all those tiny little pieces away, a little bit of dry skin there, just getting pulled down from the top of the canal wall. And just taking those couple of little loose pieces away, a little bit here on that right hand side, a little bit to the top. So we'll just sort of slowly tease all these little bits off the ear canal wall and eardrum there. I want you to take a good look at this eardrum. See, it's nice and shiny, slightly translucent, good light reflex there. So all the things we look out for in an eardrum, that becomes important for the second patient we're going to show you now. So we've got, do you know what? I've been told off for being too accurate. So I'm going to say it's an inch. Okay, we're going to go broad strokes now. An inch, 2 centimeters thereabouts. So quite a bit of sort of debris moved from both here, but a centimeter in each one. This is usually a kind of a normal amount for us to remove in a session with a client. Oh my goodness, put my teeth in. Okay, so this second patient in the compilation now. What you'll see first of all is we've got some quite loose debris around the outside edge, but the ear canal walls themselves are quite pink. Now this patient's been coming through, they've been experiencing a little bit of pain in their ears, some very muffled sensations in their ear canals as well. This patient has been along to their doctor. Because the doctor couldn't see in the ear canal, they've prescribed first of all a topical antibiotic, so a topical sort of steroid antibiotic spray, because the patient was experiencing a little bit of discomfort. That didn't really help, so they're now taking some oral antibiotics because the patient's, the GP's aid on the side of caution here, just in case the patient has an ear infection or an outer ear infection. So you can see we're just very slowly kind of taking all these little bits away, trying to be really conscious of the canal walls because the patient has been experiencing some ear pain, which is known as otalgia, so I've been getting a little bit of otalgia here. So we're just very, very slowly teasing this off the canal wall. You can see we've got this quite solid piece here right in the center. We're having to work quite close to the outer part of the ear canal, which is why the cilia are just sort of flicking up and down in front of the screen a little bit there. Now we're just going to start peeling off the canal wall here on this left hand side. You can see how that's coming away. Everything's really sort of dried onto the canal walls. Now it's not unusual to get a little bit of ear pain with wax, especially if you're very blocked up or if the wax itself is very hard, because you can get a sort of a pain that will normally travel down into your jawline, down into your neck, can travel upwards as well. So you can get all these little weird little sort of niggles in here with wax as well. So just taking away, we've got that section away now from the left hand side, so that's now freed up this section on the right hand side because that was holding this piece in. So we're just going to wiggle this very slowly down the canal. There we are, you can see we're just trying to roll it, really sort of trying to avoid sort of pulling it really off the ear canal walls, just trying to sort of roll it, maneuver it down the canal without touching too much of the canal wall. We don't want to cause the patient any further discomfort. And you can see now we've got this very, very dark section, very deep in the canal here. Now this could well have been the source of this patient's discomfort. It is dark, it's old, it's very deep, so it's in the very sensitive part of the ear canal here. So we're just going to take this nice and steady here, okay? You can see all along the bottom of our suction tube, there are all these little sort of dry flakes of skin that have come away as well. And that's because the patient has a little bit of dryness to the canal, which can make that wax then quite tough and quite hard and angular. So we've introduced a little bit of olive oil in here. It's going to help us to get a better grip on the wax because it is quite dry. It's also going to allow the wax to slide along the skin a lot better. So it means that we're causing, it won't be sort of bumping its way down the ear canal. It will slide across that skin, which is going to be a lot more pleasant for the patient when they've had some irritation in their ears. Very difficult here because we've got this dry section that's holding this, this sort of thin dry section on the canal wall, holding this deeper, much harder angular piece of dry wax in place. There we are. So this is coming away. We've managed to get to the outer part of the ear canal, less sensitive on the outer part of the canal here. You can see it's just starting to break away a little bit. Just crumbling away. So the front section snapped off it there. So we're just going to go back in with the standard size ulnar tube here. You can see I'm looking for a good grip to try and sort of wiggle this out. We've slowed this down so you can see this coming away. So there we are. There's that much deeper section. It's been pushed right down very, very deep in the canal. We've got a couple of little bits of cilia there just in front of us, a few little tiny hairs, just pulling this down. This is that thinner, dry material coming away. Now you can see it's forming these little plates in the canal just because everything's sort of dried off a little bit in there. There we are. Come away very nicely. There we are. Detach that. And it's right. Well, I want you to pay close attention to this eardrum. So have a look at this drum. I know you can see a couple of little hairs in there, which we're just going to tidy up in a second. Basically, the eardrum itself, you'll notice, looks very white. So we haven't got that translucent appearance. You can see here, it's all very white. You've got a hang on there. Now, this to me would indicate that there's probably a little bit of a middle ear infection here. You tend to see that when the eardrum goes very white because you're seeing the infected material sitting in the middle ear space. So the fact that this patient has already been prescribed oral antibiotics is going to help with that middle ear infection. You can see why the spray didn't really help. It would have softened the wax. It would have treated topically anything that was sitting on top of the canal walls there, so any irritation to the canal walls. But it obviously won't have treated anything behind the eardrum itself. Behind the eardrum, the only way we're going to clear that up is by using an oral antibiotic. So I've explained this to the patient. Now the GP can take a look in there. I've asked them to go back to their GP as well, just to make sure they get a once over with them, and obviously to keep an eye on that infection. And if the discomfort carries on, then obviously they'll go back again, possibly another course of antibiotics, more than likely, rather than a referral to ear, nose and throat. Well guys, I hope you enjoyed that one. Something a little bit different for you there, because we don't normally come across sort of middle ear infections. We've seen a few outer ones and fungal infections, but not many of the middle ear type. Well, I hope you enjoyed that video as much as I did voicing it over, guys. We shall see you again for Friday's video. As always, guys, take care of your ears, take care of yourselves, and take care of one another, and I shall see you again on Friday. All the best, guys.